Anxiety is so common in the modern world, but how does it impact your cognitive function, like attention, memory, problem solving, decision making? Hi, I'm Dr. Patricia Shelton, lead medical communicator for Tahiro. And let's take a look at this article here on Tahiro's website to understand the link between anxiety and cognitive function. Now, scientific research has pretty definitively shown that anxiety can definitely impair cognitive function. So, how does this happen? Well, when we feel anxious, the body's stress response is activated. And this results in the release of a variety of substances into the blood: adrenaline, a very short-term stress hormone; cortisol, kind of a more medium to long-term stress hormone, right? And these hormones make their way to the brain, where they act on the brain in ways that change its function. Now, in the short term, stress can actually enhance particular cognitive functions, but in a very narrow way, right? So what it does is kind of narrow a person's attention and focus and memory only onto the situation that's feeling very stressful for them. Things outside of that become extremely hard to pay attention to, right? And for the short term, we may kind of have this enhanced, like heightened ability to really pay attention to that. But long term, we start to see more of a negative impact on cognitive function. And when we have a sustained stress response over time, we know it can impact the hippocampus. This is a brain region that transfers information into long-term memory. So it starts to become hard to remember things. And anxiety leads to these thought loops, right? It puts people into these thought loops where it's hard to think about anything outside of the stressful situation. Probably you've experienced this at some point. We call this rumination, right? And then it's really hard to pay attention to anything else. Over the long term, so we see all kinds of different impacts on the brain. Besides the hippocampus, it also impacts the prefrontal cortex, which is the part of the brain that's involved in decision making, kind of long-term planning, making good choices. And because of all of those impacts, anxiety can impair our working memory. So this is when you hold things in your brain in order to work with them. Having impaired working memory, sometimes people call brain fog, right? It's just like hard to hold on to anything. It can be hard to pay attention to things, especially anything that's outside of what feels like your super urgent, stressful situation. It can be hard to problem solve and think creatively. So having that flexible type of thinking that lets you see things from a new perspective, much harder when we have chronic anxiety, right? And sleep, this is a huge one. Anxiety can impact sleep, and we know a lack of sleep has a huge range of negative impacts on the brain, definitely impairs cognitive function, and even a lack of sleep can lead to increased anxiety. So that can actually cause people to go into these feedback loops where you get anxious, so you can't sleep, so you're even more anxious the next morning. So it's really important to interrupt the stress cycle. In the long term, we can even get kind of more serious mental health problems related to having a really hard time shutting off anxiety. So it's important that we try to find ways to manage stress in order to reduce the chances that our brain is going to start to be affected by this. No, sometimes we can get out of the stressful situation, but not always, right? In fact, in the modern world, that's often kind of hard to do or even impossible. So we need to find ways to be able to deal with the stress that we find ourselves in and become more resilient to that. Different things are going to work for different people. There are, of course, anxiety medications, pharmaceuticals. They often have a ton of side effects, especially on cognition. So if you're trying to kind of preserve cognitive performance, those medications, although they may make you less anxious, they may actually have a lot of negative effects on your cognitive performance. So probably not an ideal choice. And a lot of people just really don't like taking those medicines. So we have a lot of other options. You can try a bunch of natural sort of behavioral techniques. So meditation, progressive muscle relaxation. This is a type of meditation, deep breathing exercises, yoga, biofeedback, right? There's a lot of these things that you can try. Different ones are going to work for different people. So if you try something and it doesn't help at all, maybe try something else, right? See what you can make work for you. Prioritizing sleep, absolutely huge. Like we said, there's a feedback loop between sleep and anxiety. So whatever you can do to help you get more sleep, really, really important. There are some kind of natural herbs that may be helpful for some people. So things like ashwagandha, passion flower, brahmi, lavender, right? There are a bunch of these. And these will work for some people and not for others. As always, it's very important to check in with your doctor before you try taking any type of a supplement in case it might interact with something else that you're taking or with a medical condition that you have. But these can be super, super helpful for some people. Making sure that you get enough exercise, absolutely crucial for basically every type of brain function. And then nutrition. And that's getting a healthy diet overall, but especially those healthy fats, which are so crucial for our cognitive function and overall aspects of our brain function, mood, everything. So the healthy fats, omega-3 fatty acids, we find it in fish, in nuts, in olive oil. And then also some people use supplements to make sure they're consistently able to get enough omega-3 fatty acids, and the omega-5 fatty acids, less well known perhaps, but emerging in the research as really, really beneficial for cognitive performance and for long-term brain function and protection. So if you have any questions, please email us at knowledge@tahiro.com. And as always, we're wishing you great brain health.